Have you ever wondered what happens when air gets trapped between your lung and chest wall? This condition is known as pneumothorax, a term that might sound complex, but can be broken down into something more manageable. Pneumothorax, derived from the Greek words pneuma, meaning air, and thorax, meaning chest, essentially describes a state where air accumulates in the pleural space, causing part or all of a lung to collapse. So, what causes pneumothorax? It can occur spontaneously without any apparent reason, often referred to as a spontaneous pneumothorax. It can also result from a chest injury, from a medical procedure, or from damage to the lungs due to conditions like chronic obstructive pulmonary disease, asthma, cystic fibrosis, or tuberculosis. Certain risk factors may increase the likelihood of developing pneumothorax. These include being a male between the ages of 20 and 40, being a smoker, having a history of pneumothorax, or having certain genetic disorders that impact the lungs. The symptoms of pneumothorax can vary depending on the severity and cause. However, a sudden sharp or stabbing chest pain, followed by shortness of breath, is often the first sign. Other symptoms can include rapid heart rate, rapid breathing, chest tightness, fatigue, and a bluish color of the skin caused by lack of oxygen. When a doctor examines a person with a suspected pneumothorax, they might notice diminished or absent breath sounds on one side of the chest. Other signs that can be detected using imaging tests like a chest X-ray or CT scan include a visible collapse of the lung and air surrounding it. If left untreated, pneumothorax can lead to serious complications. The trapped air can continue to build in the chest, leading to tension pneumothorax, a life-threatening condition that can cause lung failure, cardiac arrest, or shock. So how is pneumothorax managed? The goal of treatment is to remove the air from the chest and allow the lung to re-expand. This can be accomplished with a needle or chest tube insertion to drain the air. In some cases, surgery might be necessary, especially if the pneumothorax recurs. In conclusion, pneumothorax is a condition where air gets trapped in the chest, causing a lung to collapse. It can occur spontaneously or due to lung damage or injury. The most common symptoms include sharp chest pain and shortness of breath. Prompt diagnosis and treatment are crucial to prevent serious complications and allow the lung to re-expand. Remember, knowledge is power. Understanding pneumothorax can not only help in recognizing it, but also in preventing its recurrence or even its initial occurrence.